So where do you feel the most tension or pain?
Mostly in my shoulders
All the time.
Yeah.
And then last time you had some hip stuff going on, but today it's like mainly in the shoulders, tension all the time.
Right. My hips kind of feel off a little bit sometimes too. And then the right QL.
That right side of your, all those muscles. Yeah. Okay, so what we're going to do today is we're going to focus on the upper part of your back, kind of the shoulders and neck, and then I'll be able to adjust you there, and we'll see how that feels afterwards, okay?
Alright, sounds good.
Alright, so I'm going to start with you laying face down, okay? So we're going to start with you working kind of up in this area and upper back here, starting from the base of your neck all the way down this way. And the goal here is to just free up the restrictions that I'm finding in the mid-back, right where the vertebrae are. I feel a lot more tension on the right side here. Is that more tender there?
Yeah, that is.
Yeah, so right around like T5, T6 on the right side. That paraspinal muscle there is definitely a lot tighter. And that means there's some kind of stress that you're using more. You use your right hand a lot more, right? Right hand dominant?
Yes, I am dominant on the right side.
So that could possibly be why this right side is always a lot more tense. But what we want to do now is make sure we kind of remove those tensions throughout the muscles, and also the restrictions that we're finding in the vertebrae, getting those to move better by kind of using my hands and pushing through that restriction, freeing that up. And sometimes you'll hear like a cavitation, like a cracking sound, which is just a gas kind of releasing from those joint spaces in between each vertebrae. And if we can get those moving better, then these muscles have a better chance of relaxing, right? They're going to work a lot more efficiently, and then they won't be so tense, hopefully, right?
Great.
Until you start using it some more. But right in there, it's pretty tender.
Yeah, that's tender.
Yeah. And okay, so we'll go real easy, right?
Okay.
Okay, so I'm going to tilt your head a little bit. And I can feel that right in there, right around that T5 spot. So I'll take a breath in. Good. And then we're going to breathe. Breathe. Yeah, there you go. Nice. Good. Okay. Is that all right? Any pain?
No, that feels good.
That felt good? Okay. Yeah, moved out pretty well. Okay. So, let's check on this side over here, okay? So this side's not as tight, but I can feel that there's a couple restrictions right above that area as well. So let's take another breath in. Good. And we'll breathe. Good. And all the way out. Good. All right. You felt the movement there?
Yeah.
Was it uncomfortable at all?
No, that feels loose.
More of it's great. Alright. A little tight there, huh? Okay, so starting right at the TL, which is where the thoracic spine meets the lumbar spine, it's a transitional area. There's a lot of moving around here, a lot of muscle attachments there, so you can feel that both sides are pretty tight there, right, Olivia? Yes. Okay. And it kind of works our way down, both sides. And the right hip here, it's stuck. You can just feel here.
Yeah, I feel it.
Yeah, you feel that on the right side. So yeah, it doesn't move quite as much as the left. And we'll want to get that moving a little bit better. So I'm going to have you lay on your left shoulder. Yeah, it doesn't move quite as much. You said your QL was bugging you on which side? This side, right? Yeah.
That's the side.
So yeah. So the QL, it's a quadratus lumborum. It's the muscle that attaches on the top of the iliac crest with your hip. Then it goes up this way and attaches to the lower end of your ribs here. So if she said she was really tight in her QL all right here, and that can be because her hip doesn't move well. So the muscles here, the QL, have to kind of fight resistance against those movements when she uses her hip. So we're gonna try to free up that joint here, okay? Right there. All right, take a nice breath. Yep, and we'll breathe all the way out. Good. Good. Okay. Is that all right?
Yes.
Yeah. So now we have a lot more movement, right? That should free up that spot there. Okay, let's lay on your back now. So we're gonna go back to that TL area, right? In that mid spot where the thoracic spine meets the lumbar spine. We're gonna free that spot up a little bit. See here. Don't have you give yourself a hug this way.
Okay.
And scoot a little bit that way. Okay. And we're gonna do a little sit up. So you lift your head. Good. Right there. And breathe. Okay. All right?
Yep.
Okay, so just relax here. So we're gonna get past that restriction by rotating your vertebrae a little bit there, C2, okay?
All right.
So we're gonna breathe. Yeah. And relax. There you go. A little bit more here, relax. Good. There you go. Yeah. How are you doing?
Doing great.
Okay.
Yeah, feels good.
All right. So, how's that shoulder?
Everything feels a little looser on the side.
Okay. Very nice. All right. I'll be up here.
All right. Thank you.
You're very welcome.